I'm a cardiac surgeon at Mountainview Regional Medical Center in Denver, Colorado, or at least I was, until I submitted my resignation 2 months ago. You can call me Dr. Rachel Montenegro if you want, though most people in the cardiac surgery department just called me the Heart Whisperer. During my 17 years there, I've performed over 2,800 heart surgeries in my career: transplants, bypasses, valve replacements, congenital repairs, and every type of cardiac procedure imaginable. But what I'm about to tell you about is the one surgery that made me question everything I thought I knew about life, death, and the resilience of the human heart, and ultimately led me to abandon cardiac surgery forever. Mountainview Regional is a premier cardiac center serving the Rocky Mountain region, with one of the most advanced heart surgery programs in the Western United States. It's a state-of-the-art facility with a specialized cardiovascular institute that handles some of the most complex cardiac cases from Colorado, Wyoming, and northern New Mexico. During my time there, I performed hundreds of emergency heart surgeries, worked with families facing impossible decisions, and dealt with cases where the boundary between survival and death becomes both medically and ethically intricate. I graduated summa cum laude from Johns Hopkins Medical School, completed my cardiac surgery residency at Massachusetts General Hospital, and did a fellowship in pediatric cardiac surgery at Boston Children's Hospital. By the time I arrived at Mountainview Regional in 2006, I was considered one of the rising stars in cardiac surgery, particularly known for my work with high-risk cases that other surgeons deemed inoperable. The case I'm about to tell you about began long before the patient ever reached my operating table. It started on a crisp autumn morning, November 3rd, 2022, in the mountain town of Vail, Colorado, about 120 miles west of Denver. Sophia Catherine Blackwood was 32 years old and had been working as a professional ski instructor and mountain rescue volunteer for 8 years. She was an elite athlete who had competed in freestyle skiing at the national level before transitioning to instruction and rescue work. Sophia was known throughout the Vail Valley for her fearless approach to backcountry skiing and her exceptional skill in high-altitude rescue operations. Sophia lived with her partner, Emma Richardson, a veterinarian who ran a small animal clinic in Vail Village. They had been together for 6 years and were planning to get married the following spring. Sophia was also the primary caregiver for her younger brother, Tyler, who had autism and lived in a specialized care facility in nearby Avon. November 3rd began as what seemed like a routine mountain rescue call. Sophia was part of the Vail Mountain Rescue Team, an elite group of volunteers who responded to emergencies throughout the Colorado Rockies. At 8:15 a.m., they received a distress call about 2 stranded climbers on the north face of Mount of the Holy Cross, a challenging 14,005-foot peak about 30 miles south of Vail. The climbers, both experienced mountaineers from California, had been attempting a technical winter ascent when an unexpected storm system moved through the area. They had become trapped on a narrow ledge about 1,200 feet below the summit, unable to continue up or safely descend due to deteriorating weather conditions and equipment failure. Sophia was selected to lead the rescue operation due to her extensive experience with high-altitude technical rescues and her familiarity with the North Face route. The rescue team included 4 other members: Jake Morrison, a paramedic with 12 years of mountain rescue experience; Lisa Chen, a rock climbing guide and rescue specialist; David Rodriguez, a helicopter pilot; and Mark Thompson, the team coordinator. The weather conditions that morning were marginal for helicopter operations. Winds were gusting up to 35 miles per hour, visibility was reduced due to blowing snow, and the temperature was minus 15 degrees Fahrenheit, with a wind chill of minus 40 degrees Fahrenheit. Despite these challenging conditions, the rescue team decided to proceed because the stranded climbers were showing signs of severe hypothermia and had limited time before their situation became fatal. The plan was for David to fly the helicopter as close to the stranded climbers as possible, while Sophia would be lowered on a 200-foot rescue cable to reach the ledge where the climbers were trapped. Once she secured the climbers, the helicopter would extract all three of them using a specialized rescue basket system. What the rescue team didn't know was that the helicopter's cable system had developed a microscopic stress fracture during its last maintenance inspection 3 weeks earlier. The fracture had been noted in the maintenance log, but was deemed within acceptable safety parameters by the aviation mechanics. Under normal rescue conditions, the cable could easily handle loads of up to 2,000 pounds, but the conditions on November 3rd were far from normal. At 10:47 a.m., Sophia was lowered from the helicopter toward the narrow ledge where the two climbers were trapped. She was wearing full winter rescue gear, including a specialized harness, helmet, and cold weather survival suit. The total weight of Sophia and her equipment was approximately 185 pounds, well within the cable's rated capacity. Sophia successfully reached the first climber, a 28-year-old man named Alex Chen, who was semi-conscious from hypothermia. She secured him to her rescue harness and signaled for the helicopter to begin lifting them both toward the aircraft. The initial lift proceeded normally, with Sophia and Alex rising steadily through the swirling snow. They were approximately 50 feet below the helicopter when the microscopic stress fracture in the cable reached its critical failure point. The combination of the extreme cold, the stress of the lift operation, and the additional weight of the rescued climber caused the cable to snap completely. Sophia and Alex plummeted 150 feet down the near vertical north face of the mountain. Alex, who was secured to Sophia's harness, struck a small outcropping of rock about halfway down and was killed instantly. Sophia continued falling until she impacted a narrow snow-covered ledge with tremendous force. Jake Morrison, watching from the helicopter, later said that the sound of Sophia hitting the ledge was audible, even over the noise of the helicopter rotors and howling wind. The impact was so violent that it triggered a small avalanche that nearly buried both Sophia and Alex's body. When the helicopter crew finally managed to reach Sophia's location 45 minutes later, they found her buried under 3 feet of snow, unconscious and barely breathing. Her rescue gear had been partially torn away by the impact, and she was bleeding from multiple wounds, but she was alive. Jake Morrison, the paramedic, immediately began emergency medical assessment while the helicopter crew worked to extract Sophia from the snow. What he found defied every principle of trauma medicine he had learned in his 12 years of emergency response. Sophia had obviously suffered massive trauma from the 150-foot fall onto rock and ice. Her left side showed evidence of severe blunt force trauma. Her breathing was shallow and irregular, and she was unconscious with dilated pupils, signs of severe head injury. But most concerning was her chest injury. The impact had crushed the left side of her chest with such force that Jake could feel multiple fractured ribs and what appeared to be damage to her heart and lungs. When he placed his stethoscope on her chest, he heard heart sounds that no paramedic ever wants to hear. The irregular, chaotic rhythms that indicate severe cardiac trauma. Base, this is Rescue 7. Jake radioed to the Emergency Coordination Center. We have a critical patient with massive trauma from a fall, multiple injuries, including severe chest trauma, with probable cardiac involvement. Patient is unconscious, breathing shallow, blood pressure barely detectable. We need immediate transport to the nearest level 1 trauma center. The nearest facility capable of handling Sophia's injuries was Mountainview Regional Medical Center in Denver, a 45-minute helicopter flight away. Given Sophia's condition, Jake knew that 45 minutes might be too long. During the helicopter transport to Denver, Sophia's condition deteriorated rapidly, but in ways that Jake had never seen before. Her blood pressure continued to drop, her heart rate became increasingly irregular, and twice during the flight, her heart stopped beating entirely. Each time Jake performed CPR and managed to restore a pulse, but the cardiac rhythms he was seeing on his portable monitor made no medical sense. Her heart is stopping and starting again on its own. Jake radioed to the trauma center. I'm seeing rhythms that indicate massive cardiac damage, but she keeps coming back. I've never seen anything like this. What made Sophia's case even more unusual was that despite the obvious severity of her injuries and the repeated cardiac arrests, she remained semi-conscious throughout most of the flight. During the brief periods when her heart was beating regularly, she would open her eyes and try to speak. She asked about Alex, the climber she had been trying to rescue, and about Emma, her partner. Most remarkably, during one of her conscious moments, Sophia looked directly at Jake and said, "My heart feels strange, like it's fighting something." Those words would haunt Jake for months afterward. I was in the cardiac surgery department reviewing surgical schedules for the following week when my pager exploded with a level 1 cardiac trauma alert. These calls indicated that someone was being transported with life-threatening heart injuries requiring immediate surgical intervention. I had responded to hundreds of these alerts during my career, but something about this particular call felt different from the moment I received it. The trauma coordinator's voice over the hospital intercom was unusually urgent. "Inbound helicopter ETA 8 minutes. Female, 32 years old, massive blunt cardiac trauma from mountain rescue accident, multiple cardiac arrests en route. Dr. Montenegro to Trauma Bay 1 immediately." When I arrived in the emergency department, our trauma team was already preparing for Sophia's arrival. Dr. Jennifer Walsh, our head of emergency medicine, briefed me on what little information they had received from the flight medic. 32-year-old female mountain rescue volunteer fell approximately 150 feet onto rock and ice. Massive chest trauma with obvious cardiac involvement. She's arrested twice during transport but keeps coming back. The paramedic says he's never seen cardiac rhythms like what he's monitoring. Through the trauma bay windows, I could see the helicopter approaching through the late afternoon snow. As it landed on our helipad, I felt an unusual sense of dread that I couldn't explain. In my 17 years of cardiac surgery, I had developed an intuition about cases, and something about this one felt fundamentally different from anything I had encountered before. When Sophia was wheeled into Trauma Bay 1, what I saw challenged every assumption I had about human survival and cardiac trauma. She was conscious and alert, despite having injuries that should have killed her during the fall, let alone during the 45-minute helicopter transport. Her chest showed obvious signs of massive blunt force trauma. The left side of her rib cage was visibly deformed, indicating multiple fractures and possible damage to the underlying organs. But when I listened to her heart, I heard something that made me question whether my stethoscope was malfunctioning. Sophia's heart was beating, but not in any rhythm I had ever encountered. It wasn't the chaotic, irregular beating typical of severe cardiac trauma, nor was it the weak, thready pulse of someone in cardiogenic shock. Instead, her heart seemed to be beating in a pattern that alternated between normal rhythms and completely abnormal ones, as if it were switching between different modes of operation. "Dr. Montenegro," Sophia said, looking directly at me with eyes that were far too alert for someone with her injuries. "I can feel my heart doing something strange. It feels like it's fighting to stay alive." I had never heard a patient describe their cardiac sensation in those terms, and the clarity of her statement despite her obvious trauma was medically inexplicable. The initial imaging studies showed damage that I had never seen in a living patient. The CT scan and echocardiogram revealed that Sophia's fall had caused what appeared to be multiple tears in her heart muscle, damage to at least 2 of her heart valves, and bleeding into the pericardium, the sac surrounding the heart. Most shocking was the damage to her left ventricle, the heart's main pumping chamber. The imaging showed what appeared to be a complete rupture of the ventricular wall, an injury that is almost always immediately fatal. Patients with ventricular ruptures typically die within minutes. Yet Sophia had survived not only the initial trauma, but also a 45-minute helicopter flight, and was now having a coherent conversation with me in the trauma bay. Dr. Mark Stevens, our head of cardiology, looked at the imaging studies and shook his head. "Rachel, these images show injuries that are incompatible with life. This patient shouldn't be conscious, let alone talking to us. Something doesn't add up." But the imaging wasn't wrong. We repeated the studies twice, using different machines and different technicians, and the results were consistent. Sophia's heart had sustained damage that should have been instantly fatal, yet she was not only alive, but showing cardiac function that, while abnormal, was sufficient to maintain consciousness and basic organ function. Emma, Sophia's partner, arrived at the hospital about an hour after Sophia was admitted. She had driven frantically from Vale through a snowstorm, and when she saw Sophia in the trauma bay, she broke down completely. "Is she going to be okay?" Emma asked me, her voice shaking with fear and exhaustion. I struggled with how to answer her question honestly. Everything I knew about cardiac trauma told me that Sophia should already be dead, but she was very much alive and seemed to be maintaining stability despite her catastrophic injuries. "Emma, Sophia has suffered very serious injuries to her heart. The damage is extensive, and under normal circumstances, these injuries would be..." I paused, trying to find the right words. "These injuries are typically fatal. The fact that Sophia is conscious and talking to us is something I can't fully explain from a medical standpoint." Emma sat down heavily in a chair beside Sophia's bed. "She's always been a fighter. Even as a kid, she never gave up on anything. When she was competing in freestyle skiing, she would train through injuries that would sideline other athletes." As Emma spoke, I watched Sophia's cardiac monitor. Her heart rhythm continued to fluctuate between normal and abnormal patterns, but each time it became chaotic, it would somehow return to a more stable rhythm on its own. It was as if her heart was actively fighting to maintain function despite the devastating damage it had sustained. After reviewing all of Sophia's diagnostic studies and consulting with my surgical team, I was faced with a decision that challenged everything I thought I knew about cardiac surgery. The damage to Sophia's heart was so extensive that attempting surgical repair seemed futile. The likelihood of her surviving major cardiac surgery in her current condition was virtually zero, but not operating would certainly result in her death, probably within hours. Despite the severity of her injuries, Sophia was alert, communicating clearly, and expressing a strong desire to survive. She had asked about returning to mountain rescue work, about her upcoming wedding to Emma, and about being able to continue caring for her brother Tyler. "Dr. Montenegro," Sophia said during one of our conversations, "I know something's really wrong with my heart. I can feel it, but I also feel like it's not ready to give up yet. Does that make any sense?" Medically, it made no sense at all, but looking at Sophia, seeing her determination and the love in Emma's eyes, I made the decision to attempt what might be the most challenging cardiac surgery of my career. "We're going to operate," I told Emma and Sophia. "I want you both to understand that this surgery is extremely high risk. The damage to Sophia's heart is more extensive than anything I've ever attempted to repair. But Sophia is stable right now, and that's giving us a window of opportunity that we might not have later." I called in my most experienced surgical team for what I knew would be an extraordinary procedure. Dr. Michael Chen, my senior cardiac anesthesiologist with 15 years of experience. Dr. Sarah Rodriguez, my chief cardiac surgery resident, and Nancy Peterson, our head cardiac surgery nurse, who had worked with me for over a decade. I also requested Dr. James Morrison, another cardiac surgeon, to scrub in as my assist. Given the complexity of Sophia's injuries, I wanted another experienced surgeon available for consultation and backup. As we prepared Sophia for surgery, I explained the situation to my team. "This patient has sustained cardiac injuries that are theoretically incompatible with life, yet she's been stable for several hours now. We're going to attempt repairs that have never been successfully completed on injuries this extensive. I want everyone to be prepared for complications we've never encountered before." Nancy, who had assisted on thousands of cardiac surgeries, asked the question that was on everyone's mind. "Dr. Montenegro, have you ever seen anyone survive this type of cardiac trauma?" "Never," I replied honestly. "But this patient is showing us something we've never seen before. Her heart is somehow maintaining function despite damage that should be fatal. We're going to find out if that's enough to get her through surgery." As Dr. Chen began administering anesthesia, something unprecedented happened. Sophia's heart rhythm, which had been fluctuating between normal and abnormal patterns, suddenly stabilized into a completely normal sinus rhythm. Her blood pressure, which had been marginal, improved to near normal levels. "Rachel," Dr. Chen said, looking at his monitors with confusion, "her cardiac function is actually improving as we prepare for surgery. I've never seen anything like this. It's as if her heart knows we're about to help it and is preparing itself for the procedure." I had heard of patients' physiological responses improving before surgery due to reduced anxiety or the effects of pre-medication, but what we were seeing went far beyond normal pre-surgical changes. Sophia's heart appeared to be optimizing its function in preparation for the repair we were about to attempt. As we wheeled Sophia into operating room 2, our largest and most advanced cardiac surgery suite, she squeezed my hand and said something that would stay with me forever. "Dr. Montenegro, I can feel my heart getting ready. It wants to be fixed." At 6:30 p.m. on November 3, 2022, we began what would become the most extraordinary and inexplicable surgery of my career. The procedure started with a median sternotomy, opening Sophia's chest by cutting through her breastbone to access her heart. What I found when I opened Sophia's chest cavity defied every principle of cardiac surgery and trauma medicine I had learned during my 17-year career. The damage was even more extensive than the imaging studies had shown, yet somehow, incredibly, her heart was beating stronger and more regularly than it had since her arrival at the hospital. The impact from her fall had caused tears in multiple chambers of her heart, damaged several of her heart valves, and torn one of her major coronary arteries. There was extensive bleeding throughout her chest cavity, and portions of her heart muscle showed signs of severe bruising and trauma. But here's what still gives me chills when I think about it. As we began working to repair the damage, Sophia's heart seemed to be actively participating in its own healing. Normally, during cardiac surgery, the heart becomes increasingly stressed and requires support from medications and mechanical devices. Sophia's heart was doing the opposite. It was growing stronger as we worked. "Dr. Montenegro," Dr. Rodriguez said about 2 hours into the surgery, "I'm seeing cardiac output and pressure readings that shouldn't be possible given the extent of this damage. It's like her heart is healing itself while we're working on it." I had to agree. As we repaired each tear and reconstructed each damaged valve, the heart tissue around our repair sites appeared to be responding at an accelerated rate. Areas that should have shown signs of surgical trauma instead appeared to be healing almost in real time. What happened over the next 6 hours challenged everything I thought I knew about human physiology and the limits of cardiac surgery. As we methodically repaired each area of damage to Sophia's heart, her cardiovascular function continued to improve rather than deteriorate. Dr. Chen, monitoring her vital signs throughout the procedure, kept reporting readings that made no medical sense. Her blood pressure is not only stable, it's optimal. Her cardiac output is actually above normal ranges. I'm seeing responses to our surgical interventions that I've never witnessed before. The most remarkable moment came when we were repairing the tear in Sophia's left ventricle, the injury that should have been immediately fatal. As we placed the first sutures, I noticed that the heart muscle around the repair site was contracting more forcefully, as if it were actively assisting with the repair process. "Nancy," I said to our head nurse, "are you seeing what I'm seeing? The heart muscle is responding to our sutures as if it's aware of what we're doing." Nancy, who had seen every type of cardiac surgery imaginable, nodded slowly. "Montenegro, in 20 years of cardiac surgery, I've never seen heart tissue respond like this. It's almost like the heart is cooperating with us." By 2:15 a.m. on November 4th, We had successfully repaired all of the identifiable damage to Sophia's heart. The tears were closed, the valves were reconstructed, the coronary artery was repaired, and the bleeding was controlled. But the real miracle wasn't our surgical technique. It was the fact that Sophia's heart was now functioning better than many healthy hearts I had seen. The cardiac monitor showed rhythms and pressures that indicated not just survival, but optimal cardiac function. Dr. Morrison, who had assisted throughout the procedure, spoke for all of us when he said, "Rachel, I don't think any of us will ever see anything like this again. This heart was essentially destroyed, and now it's functioning like it was never injured." As we prepared to close Sophia's chest, I noticed something that would haunt me for months afterward. The heart tissue around all of our repair sites showed no signs of surgical trauma or inflammation. Instead, the tissue appeared to have healed so completely that it was difficult to identify where we had made our repairs. "This is impossible," Dr. Rodriguez whispered, staring at Sophia's heart. "Cardiac tissue doesn't heal this quickly. What we're seeing should take weeks or months, not hours." Sophia emerged from anesthesia much more quickly than any patient should, after undergoing 8 hours of complex cardiac surgery. Most patients who undergo this type of extensive cardiac procedure remain sedated and on ventilator support for at least 24 and 48 hours. Sophia was awake and breathing on her own within 2 hours of leaving the operating room. When Emma was finally allowed to see her in the cardiac ICU, Sophia was not only conscious and alert, but she appeared to have no memory of the severity of her injuries or the complexity of the surgery she had just undergone. "How do you feel?" Emma asked, tears streaming down her face. "I feel amazing," Sophia replied, her voice clear and strong. "My chest is sore from the surgery, but my heart feels better than it has in years. It feels stronger somehow." I was standing nearby, monitoring Sophia's initial post-surgical responses, and her statement about her heart feeling stronger was medically baffling. Patients who undergo major cardiac surgery typically feel weak and exhausted for weeks or months afterward. The idea that Sophia's heart could feel stronger immediately after extensive surgical repair defied every principle of cardiac recovery I had learned. Over the next 48 hours, Sophia's recovery continued to defy medical explanation. Her cardiac function tests showed results that were not just normal but actually superior to average healthy adults. Her blood work showed no signs of the cardiac enzymes that typically flood the bloodstream after heart surgery. Most remarkably, follow-up imaging studies showed that her heart appeared structurally perfect, with only minimal evidence of the extensive surgical repairs we had performed. I consulted with colleagues at major medical centers across the country, reviewed every piece of literature I could find on cardiac trauma and surgical repair, and ran every conceivable test to try to understand Sophia's miraculous recovery. Nothing in the medical literature described anything similar to what I had witnessed in that operating room. Dr. Stevens, our head of cardiology, spent hours reviewing Sophia's case files. "Rachel, I've been practicing cardiology for 25 years, and I've never seen anything like this. Her heart function is actually better now than it was before her accident. It's as if the surgery didn't just repair the damage, it somehow optimized her entire cardiovascular system." The most logical explanation seemed to be that our initial assessment of her injuries had been wrong, that the damage hadn't been as severe as it appeared. But when I reviewed the surgical video recordings, the imaging studies, and the detailed surgical notes, there was no doubt about the extent of the damage we had repaired. Sophia's heart had been destroyed, and then somehow rebuilt itself during surgery. Sophia was discharged from the hospital on her 4th post-operative day, a recovery timeline that would be considered rapid for routine cardiac surgery, let alone the extensive reconstruction we had performed. Her cardiac function was superior to normal, she had no activity restrictions, and she showed no signs of the complications that typically follow major heart surgery. "When can I go back to mountain rescue work?" Sophia asked during her discharge consultation. Under normal circumstances, I would have told a patient with her surgical history that they could never return to high-risk physical activities. But Sophia's cardiac function was so superior that I couldn't find any medical justification for restricting her activities. Based on your test results, there's no medical reason you can't return to full activity, I told her, though the words felt strange coming out of my mouth. Your heart function is actually better than most people who have never had heart surgery. The case attracted significant attention throughout the hospital and the regional medical community. News of Sophia's recovery spread among cardiac surgeons, with doctors from other states calling to discuss the mountain rescue miracle and the woman whose heart rebuilt itself. But for me, Sophia's case raised questions that I couldn't answer and ultimately couldn't live with. How had her heart continued to function with injuries that should have been instantly fatal? Why had her cardiac function improved during surgery rather than deteriorated? What had caused the accelerated healing I had witnessed during the procedure? As Sophia returned to her normal life, she was back to mountain rescue work within 8 weeks and married Emma in a beautiful ceremony the following spring. I found myself obsessively trying to understand what had happened in that operating room. I began questioning every cardiac surgery I performed, wondering if there were aspects of human physiology that medical science didn't understand. During surgeries, I found myself looking for signs of the mysterious healing response I had witnessed with Sophia, but I never saw anything similar. The weight of these unanswered questions began to affect my ability to function as a cardiac surgeon. I started second-guessing my surgical decisions, spending excessive amounts of time reviewing cases that should have been straightforward, and struggling to provide families with the confident assessments they needed. 6 months after Sophia's surgery, I was operating on another cardiac trauma patient when something happened that would ultimately end my career in cardiac surgery. The patient, a 45-year-old construction worker who had suffered a heart attack after falling from scaffolding, arrested on the operating table just as we were completing the repair. As I worked frantically to restore his heartbeat, I found myself thinking about Sophia's case, wondering why her heart had fought so hard to survive while this patient's heart seemed ready to give up. The distraction caused me to make a critical error in my resuscitation efforts, and despite our best efforts, the patient died on the operating table. That death wasn't medically my fault. The patient's injuries were severe and his prognosis was poor from the beginning. But I knew that my obsession with understanding Sophia's impossible recovery had compromised my focus during a critical moment, and that knowledge was something I couldn't live with. I submitted my resignation from Mountainview Regional Medical Center 3 weeks later. What I witnessed in Operating Room 2 that night challenged everything I thought I knew about the limits of human survival and the mysteries of the human heart. But the story doesn't end there. What happened 6 months later during another surgery would finally drive me away from cardiac surgery forever, and reveal even more disturbing questions about what we truly understand about life, death, and the power of the human will to survive. 6 months after Sophia's miraculous recovery, Emma called in panic. Sophia had collapsed at the mountain rescue station with chest pains. When she arrived at our emergency department, her cardiac monitor showed the same impossible alternating rhythms I'd witnessed before her surgery, but this time was different. Her heart wasn't just functioning, it was evolving. The test results defied medical science. Sophia's heart chambers had grown larger and more muscular than any human heart I'd ever seen. Her cardiac output measured at superhuman level. Her resting heart rate had dropped to 35 beats per minute, not from illness, but from incredible efficiency. My heart feels like it could power anything, Sophia told me. I can hold my breath for 8 minutes now. I feel like I could climb Everest without oxygen. Blood tests revealed cardiac proteins that didn't exist in medical literature. Lab technicians called asking if we'd made errors. Her biochemistry didn't match human reference databases. During consultation, Sophia revealed something that froze my blood. During my surgery, I wasn't completely unconscious. I could feel my heart talking to me. It said it was tired of being weak and wanted to become something stronger. I said yes. Her transformation was accelerating. Each week brought new superhuman capabilities. Mountain Rescue reported she could carry equipment loads requiring 2 people, work at impossible altitudes, and maintain peak performance for hours without fatigue. 3 months later, I operated on 16-year-old Ashley Martinez for a congenital heart defect. During surgery, her heart tissue felt different, more responsive. Her cardiac function improved beyond normal parameters during the procedure. When Ashley emerged from anesthesia, she looked at me with knowing eyes. "Dr. Montenegro, my heart feels different, stronger, like it learned something from someone else's heart." That night I realized I could no longer practice cardiac surgery, whether through unknown medical mechanisms or something far more disturbing. I had become a surgeon who could trigger superhuman transformations in human hearts. The power was terrifying. The ethical implications were staggering. The potential consequences were completely unknown. I submitted my resignation the next morning and moved to rural Wyoming, deliberately avoiding cardiac cases. But I never stopped thinking about Sophia and Ashley, and the questions their cases raised about organ consciousness, human evolution, and the boundaries of what we consider normal. Through colleagues, I learned both patients' transformations continued progressing. Sophia developed the ability to sense other people's heart rhythms and emotional states. Ashley guided a school nurse through CPR with intuitive cardiac knowledge exceeding her training. Most disturbing, other patients at our medical center began showing subtle cardiac enhancements following surgery, as if hearts could learn from each other. The case of the woman who couldn't die revealed that human hearts might possess consciousness and evolutionary capability beyond our understanding. It ended my career and continues to haunt me daily, challenging everything I thought I knew about the boundaries between human and superhuman, and whether our organs can choose their own evolutionary destiny. The heart, it turns out, might be far more intelligent than we ever imagined.